interview, and your interviewer asks you, "So, tell me about a time when you provided effective patient education." A lot of healthcare employers are leaning towards asking these behavioral-based interviewing questions, not only to weed out the posers or the underqualified candidates, but to get a sense of who you truly are and how you would behave under certain circumstances while working. Now, during my 6 years as a nurse recruiter, I noticed that there were some common themes when it came to asking behavioral-based interviewing questions. So when it comes to the nursing profession, they're usually based around teamwork, patient care, adaptability, time management, communication style, core values, and motivation. So in this video, I'm going to ask you some sample questions. Go ahead and hit pause, write out your sample question on pen and actual paper, and then press play and I'll give you some tips. I've also teamed up with nurse.org on this video. Watch it to the end because we have some great resources to help you with your interviewing preparation. A few quick tips to answering behavioral-based questions overall is to tell stories, give actual real-life examples, and number 2, answer the questions using the STAR format. So STAR is an acronym. It stands for situation, task, action steps, and results. You'll just want to walk them through the actual situation, exactly what the task was, what your role was in the task, what specific action steps you took towards the result. Tell them the result, tell them what you learned from it, or what you might do differently now. Teamwork-based interviewing questions are asked to gauge how you will fit in with the current healthcare team and to also see how you interact with various personality types. Question number 1 is to describe a situation when you had to work with a difficult coworker. How did you handle the situation? The key here is to not badmouth or talk negatively about a coworker. Since it is a negative situation, you'll want to talk about how it was either flipped into a positive or talk about what you learned out of the situation. Question number 2 is to describe a time when you were very proud of your healthcare team. What was your role in this situation? The interviewers are trying to get to the core of who you really are and learn about what you value in a team setting. Employers want to hire nurses who provide excellent patient care while multitasking their other duties and who understand the value of patient education. Question number 3. Tell me about a time when a patient's family was dissatisfied with your care. How did you handle that situation? Interviewer is interested in learning about your thought process and how you react to criticism, negativity, or heightened emotions. Tell the story step by step. Number 4. Give an example of a time you had to explain medical terminology or medical jargon to someone who is not medically trained. The majority of the population is not medically trained. Employers are looking to get a sense for your education style when you're talking to just your average Joe Schmo off the streets. I suggest telling stories of crisis, urgency, or challenges and explaining key takeaways and lessons that you've learned. Number 5, describe a time when your facility was undergoing a change. How did that change affect you and how did you adapt? Employers want to see that you are resourceful and that you are open to change. Give examples of such times. Number 6, tell me about a time when you didn't know something at work. How did you go about finding the information? They are looking for nurses who are resourceful, who know the proper policies and procedures, but who also know how to find the answers to their questions, even if there's no other nurses around to ask. Employers ask time management questions not only to gauge a sense of your punctuality, but to learn more about your ability to multitask, meet deadlines, and stay organized through it all. Number 7, talk about a time you worked in a fast-paced setting. How did you prioritize your tasks while maintaining excellent patient care? They're interested in learning about your specific thought process. They may even give you a task list and ask you to prioritize it and explain step by step why you would do the tasks in that order. Number 8, tell me about a specific goal that you set for yourself and accomplished. How did you ensure that the goal was accomplished? This question gives them a sense of what matters most to you. It also proves that you are able to start and finish something. Talk about your resiliency, your challenges, and how you remain focused. Employers want to know about your communication style, techniques, and learn more about your lovely personality. So always walk them through step by step your exact thought process and remember to give examples. Number 9, give an example of a time when you were able to successfully persuade a patient to do something. Employers are looking to learn more about your personality and how you interact and communicate with patients. Give a great example of that. 10, talk about a time that you did not communicate well. How did you go about correcting the situation? No one's perfect, and employers are not looking to hire perfect nurses. They're looking to hire people who are teachable and who are trainable, who take responsibility for their actions, and who actively seek out growth opportunities. Questions, employers are trying to get at the root of your motivation and what your personal values are. I suggest telling motivational stories that speak to your core values. Number 11, describe a time when you went over and above your work requirements. What motivated you to put forth the additional effort? Not only does this question convey the type of employee that you are, but it also gives them an idea of what your driving motivation is and personal core values are. Number 12, what do you find most difficult about being a nurse and how do you overcome this difficulty? Look, we understand that being a nurse is challenging. There are difficult times. We want to know more about what drives you to get up in the morning and go to work every single day, even after you've had a tough shift or maybe you're unhappy in your specialty. Give stories and examples of what you've done to overcome your challenges. And lastly, always be prepared to answer these 5 questions because they're really commonly asked. Number 1 is to tell me about yourself. Number 2, what are your greatest strengths and weaknesses? Number 3, what do you know about our facility? Number 4, how do you handle stress? And number 5, why should we hire you? So there you have it. If there are still questions that you are weary about, or maybe questions you've been actually asked in interviews, let us know in the comments and I'll do my best to walk you through how to answer those questions confidently. I've also teamed up with nurse.org, which is a leading career website and job board for nurses. And we've created a step-by-step guide to help walk you through the interviewing process and help you to answer questions confidently. It includes sample interviewing questions with answers, checklists, and my very best advice from over 10 years as both a recruiter and a career counselor. So follow the link down below in the description. Lastly, make sure to subscribe to my YouTube channel and also follow me on Instagram. I'm always posting lots of career tips and advice for traveling nurses and nurses in general. And to all of the nurses who are watching, thank you so much for all that you do. Thank you so much for being you. Bye, guys.